Our today's topic is dorsum of the hand. In this picture, we can see the dorsum of the hand. This area here is called the anatomical snuff box. This is the first dorsal interosseous muscle. These are the long extensor tendons. Now, what is dorsal venous plexus? Dorsal venous plexus is basically a venous plexus, a network of veins on the dorsum of the hand. So plexus of veins on the dorsum of the hand. So what happens is that these are the dorsal digital veins which join to form the dorsal metacarpal veins, which are combined, three dorsal metacarpal veins in the center. They are joined by one dorsal digital vein from the little finger and two from the thumb, and together they form cephalic vein on the lateral side and the basilic vein on the medial side, which go all the way up to the forearm. Now, the sensory nerve supply, as I've mentioned in some other video of mine, that is of palm, it is that on the palmar aspect, the medial 1.5 fingers and palm is supplied by ulnar nerve, and likewise on the dorsum, the medial 1.5 is supplied by the ulnar nerve. Now, coming to the lateral, 3.5 fingers on the palmar aspect and palmar aspect, the lateral 3.5 fingers plus palm. These are supplied by the median nerve, and the three nail beds of these three fingers on the dorsal side are also supplied by the median nerve. And the dorsal aspect, lateral 3.5 fingers, remaining part is supplied by the radial nerve. So this is the sensory nerve supply of the palm and dorsum. Now, what is dorsal carpal arch? Just like the palmar arches of the superficial and the deep palmar arches of the palm, on the dorsum we have the dorsal carpal arch. It is formed by branches of the radial artery and the ulnar artery. These branches join and form a dorsal carpal arch. It is at the level of the carpal bones. It gives off dorsal digital arteries, which supply first of all it gives dorsal metacarpal arteries, and then they are further subdivided to form the dorsal digital arteries which supply the digits of the hand. The various spaces on the dorsum of the hand are the dorsal subcutaneous space that lies just below the skin, and the dorsal subtendinous space that is lying below the tendons, the extensor tendons. So hence the name subtendinous space. Now, what is extensor retinaculum? Extensor retinaculum is just like flexor retinaculum present on the extensor surface of the wrist. It is attached laterally to the lower end of radius, and medially it is attached to the pisiform and triquetral bones. There are various structures that are passing beneath the extensor retinaculum, as we can see from this picture, but all this area of the extensor retinaculum is subdivided into 6 compartments, and various structures are passing separately through these 6 compartments. In this picture we can very clearly see, starting from the lateral side, first compartment, this one, has abductor pollicis longus and extensor pollicis brevis. The second compartment has extensor carpi radialis longus and the extensor carpi radialis brevis. The third compartment has only the extensor pollicis longus. The fourth compartment has the 4 tendons of extensor digitorum plus the extensor indicis muscle. The fifth compartment has extensor digiti minimi muscle, and the sixth compartment has extensor carpi ulnaris. Hence, all the extensor tendons of the forearm going towards the dorsum of the hand are passing under the extensor retinaculum. Now, venous drainage of upper limb is such that the dorsal digital veins here join to form the dorsal metacarpal veins, forming dorsal venous plexus, which continues up on the lateral side to the cephalic vein and on the medial side to the basilic vein. And these veins at the level of cubital fossa are connected by the median cubital vein, and then they go up and finally are drained. Here once again we can see the venous drainage of the upper limb. The lymphatics of the upper limb are drained by various groups of lymph nodes, which are mainly the axillary lymph nodes, the deltopectoral lymph nodes, the subscapular for the types of the axillary lymph nodes, which are the anterior, posterior, lateral, and apical lymph nodes, and then the cubital lymph nodes. All these drain the upper limb. The median cubital vein is the one that is used for IV injections and venipuncture. In this picture, we can see this one is the cephalic vein and this is the basilic vein. These two are connected by the median cubital vein, which is used for venipuncture. Now, what is a dermatome? A dermatome is an area of the skin that is mainly supplied by a single spinal nerve. In this picture, we can see the dermatomes on the front of the hand, forearm, arm, and scapular region, and this is the back. So all starting from C3 to C8 and some part of T1, T2, T3, and T4. These are mainly T1 and T2. These are supplying the upper limb. So this is all about today's class. Thank you.